The St. Charles Health System is considering dropping Medicare Advantage coverage for patients this fall. Blake Mayfield spoke with the hospital and an insurer about the potential change.
I have my own clients with this insurance, about 1,500, but I know that about 26,000 people may be affected by this in Central Oregon.
The St. Charles Health System has 4 hospitals in its network. The system is considering dropping Medicare Advantage insurance plans.
And often what happens is that Medicare Advantage plan gets in between the patient and the provider and makes choices that either delay discharge or prevent access or change the financial circumstance retroactively after care has been provided.
St. Charles also cites the burden of paperwork, staffing shortages, and delays in transferring patients.
We also see them financially disadvantaged when we get denials for the services that the patients needed that have already been delivered, which puts things in a real awkward position.
PacificSource says they currently have 15,000 people on their Medicare Advantage plans.
We also have about 2,500 members who are both are called Medicaid, Medicare dual eligibles. Those are folks that are some of the most vulnerable folks in the community who are both low income and oftentimes have a disability as well.
I think it would be a financial burden for a lot of people because PacificSource is free.
Kate Bailey has lived in Bend for over 20 years. She's had a Medicare Advantage plan to help her with unexpected medical costs, along with dental, vision, and hearing services.
We don't have that, then we have to go back to Medicare, get their Part D, get some other gap coverage kind of thing, and it's going to be very expensive, very time-consuming, and I think the customer service is going to go out the window.
Some think there may be a way for St. Charles to keep Medicare Advantage insurance with fewer issues.
My suggestion would be to use the Central Oregon Health Council as a negotiator to help work out those operational differences. Otherwise, you're going to put the most at-risk population in the Tri-County region at risk.
With original Medicare, there is no limit to the out-of-pocket expense for the individual, where the Advantage plans are required to have a maximum for the patient.
St. Charles expects a decision by early fall. Patients would receive a minimum of 30 days' notice through their insurer.
It is important that we elevate the concerns of providers and caregivers that are in short supply and quite valuable and need to be here in order to provide the care that the community needs.
The enrollment period for Medicare coverage is October 15th to December 7th. If St. Charles chooses to drop Medicare Advantage plans, the change could take effect as soon as this fall. Blake Mayfield, News Channel 21.